Welcome to Ponchatoula Live, the show where we make it easy for you to connect with the people of Ponchatoula. My name is Parker Layrisson. I'm your host, and today I've got a fantastic guest. This is somebody who's incredibly accomplished professionally, and she's so well liked personally. She's one of my favorite people. Her mother has been on the show, was one of our most popular interviews ever. She's a former Strawberry Queen. She's a doctor, a mom, and much more. I am speaking, of course, about Dr. Jeni Abrams Dunnington. Jeni, welcome to the show.
Hey, Parker. Thanks for having me.
I'm super excited about having you on. Everyone knows that your mother is Robin Abrams, who is normally the big deal in your family, although I guess now your dad is Nurse of the Year at Norfolk, so maybe
he's giving her a run for his money.
Yeah, he's had a big year. All of you are highly accomplished, and I've been really looking forward to your episode of the show. Why don't we kick things off with you just telling us a little bit about yourself?
Sure. So my name is Jeni Abrams Dunnington. I am Ponchatoula Parish born and raised. Grew up in the great big old town of Loranger. Went to Loranger High School, spent many years cheering over there, and then moved on over to Southeastern, and I guess the small little thing in Ponchatoula that we have kind of made Ponchatoula home for me when I was the Strawberry Queen in 2009.
Yeah, just a small little festival that's coming up in a few weeks with hundreds of thousands.
It's the smallest one I've ever seen.
So what year were you Queen? 2009?
2009, yes.
Well, what number does that make you in the Queens?
38.
Okay, cool. So I'm married to Strawberry Queen 34.
Yep,
and of course, your mother groomed her to help her, become queen ready, I guess. I don't know what the right terminology is. Your mom is like the Bill Belichick and Phil Jackson all rolled into one in coaching queens. You may know her count. I've long lost count. I think it's more than two hands worth that she's helped get there.
She's put her hand in with quite a few of us, yes.
So you had an in-house resource there that helped. But of course, you deserved it 100% and probably would have gotten there on your own. What's it like growing up in Robin and Charles Abrams' house? I mean, both of your parents are just wonderful people. They're highly accomplished professionally. They're beloved personally. But what were they like as mom and dad to you?
As a child, honestly, and even as a teenager, most kids talk about, I had to hide from this or I had to hide that from them. My mom and daddy were always two people that I was never scared to tell them anything. They were the parents that if we found ourselves in a sticky situation, we picked the phone up and we gave them a call. There was a time or two, that I may have flooded the house. And they weren't necessarily the ones I called first, but I lived in their house till I was 23, Parker, because there was never a curfew, because they knew I was going to do exactly what I was supposed to do. So they were very lenient.
Yeah. Well, it sounds like you were the kind of kid that they didn't have to ride that hard because you.
I hope to have that in my daughter.
Well, I'll pray for you that happens, because I know some people, like my wife, are like that. Others, like my brothers and myself, not so much. But I do want to get the details on these floods. So not one, but two floods. Same cause, different causes. Tell us more about that.
Same cause. That would be a bathtub. So the first time was very minor. Just right in the bathroom. The second time, though, I was babysitting. And my brother and the little kid I was babysitting for were outside, and I had been laying out on the pool deck trying to get a tan. And I went inside and I was going to go take a bath and decided not to. Went around to the computer room, and the boys came inside and I said, "Hey, y'all go change your clothes because I don't want water all in the house."
Okay.
About 30 minutes later, I might have stepped over into water, and there was water coming through every wall in my parents' house. It wasn't.
So who do you call there? The kind of one and only, or two times in your life you're scared to call dad, scared to call mom. What do you do there? Do you have a plumber on speed dial? A best friend who knows?
No, that would be my grandma. "Hey, Nani, I messed up. Please come help me."
Nice. I love it. Well, that's really neat. I know you have a close knit family. You got, like you say, you live there till you're 23. What's that experience like? So, when did you decide you were going to become an audiologist, go to graduate school, become a doctor. Did you know that kind of going into college or not? So what was your college experience like, living at home with mom and dad and discovering this profession you've entered along the way?
So even though that I was living at home with them, I was still working full time. Well, I say full time. I was still working as a licensed pharmacy tech. So I got all of my hands-on training at Paul's Pharmacy over in Laranger. I did float to Independence and Hammond with Mr. Paul Durnan, and I was a licensed pharmacy tech, and that's what I thought I wanted to go to school for. I thought I wanted to be a pharmacist, and I got to chemistry and said, nope, this is not for me. I don't want to do this.
Right.
So I was trying to figure out what I wanted to do. Where do I want to go? And they're like, Jeni, you're so good with kids. Go be a teacher. It's like, I don't really want to be a teacher. And we'll segue into that in a second. But I don't really want to be a teacher. So I found speech language pathology. And when you take speech language pathology courses to be a speech therapist, they make you take audiology courses, because if you can't hear, you can't speak, or you can't produce it appropriately. So I absolutely fell in love with the field of audiology at that point, and from then on, I knew I wanted to be an audiologist. And now I get the pleasure of actually teaching that introduction to audiology course at Southeastern that made me fall in love with this profession so many years ago.
Wow. So when did that start? When did you start teaching? That's an exciting honor.
So I believe that was 2019 that they called me and they said, hey, you wouldn't happen to be interested in teaching this course. So I taught it for 2 semesters.
Right.
And then COVID hit. I was like, okay, so how are we going to do this? So we switched everything to virtual and online classes. And I still now on Thursday nights teach online remotely from my office. And it's really a cool feeling for me to give back to our profession in such a way that we're teaching so many people what goes on in our day-to-day life.
Yeah. Well, that's so neat to hear, because around the same time, I got a similar call from LSU Law School and had the opportunity to go back there and teach. I now teach 2 courses a year. And as you've described, it's so rewarding.
Absolutely.
It's just the neatest thing in the world. I was talking to a buddy of mine the other day who was my teacher in law school 23 years ago. And he became a federal judge and moved to New Orleans. And he's got this important job and busy family life and a ton of extracurriculars going. But he still makes his way up, like you, on Thursday nights at LSU. And I was like, man, how do you do that? It's late night. He's like, man, I sleep at my mom's house. It all works. But like, my point here is, it's something that once it gets in your blood, it's so rewarding. And
they
it sounds
ask me every year. They ask me, they're like, hey, "Are you going to teach next semester? Are you good to teach next semester?" And every time my response is, "I will teach as long as my schedule and my daughter's schedule aligns with it."
Very cool. Very cool. Well, they're lucky to have you. And I know that program is tremendous, because both of my boys receive speech therapy from Southeastern and have for years. They've done the speech therapy camp. And so to hear that, I didn't realize that that's where an audiologist would kind of start at the undergrad level. I had no idea the connection. Other than that, I know, like you said, that you have to have the hearing checked and all before you get into these speech classes.
Right.
But it's really important. And what you do and what they do is God's work. One of my boys didn't speak at all till he was 3 years old. As a parent, that's terrifying. You wonder what else is going on. You look in every direction you can. And he's just made tremendous progress. And now he's an honor student with a bunch of friends. And, he still goes to speech therapy, but life is good. And we're very grateful to you and your colleagues that do that kind of work. So you get there, you kind of find this love of audiology. If you don't mind, because I know this much about it, in that I know audiologists have helped my mom tremendously. Once upon a time, she was getting this bad vertigo, and she saw all these specialists. I think maybe an ENT, a neurologist, who nobody knew what was what, but it was the audiologist that basically, figured out what was going on, put her on some kind of table that sounded like voodoo to me at the time. But all I know is mom got better, and she went from having frequent problems to basically being fine for years. So I guess what I'm getting at is, some doctors we know a lot about, because there's a show called Grey's Anatomy, and we all see, I don't know how fictionalized it is, but we kind of get a feel for how surgeons become surgeons, because Meredith Grey's been on TV for 20 years in a row. I'm not aware of someone in your profession being covered like that. So for those of us that are ignorant, what do y'all do? How do you get there? What's the educational process to becoming
Sure.
that type of doctor? And then the follow up to that, what was your journey like to get there?
Sure. So, an audiologist is a hearing and balance specialist. We have the knowledge, the certifications to not only diagnose, but treat hearing and balance disorders. A lot of people don't realize that your organ for hearing and your organ for balance are the same organ, it's just two separate parts. So, they work very closely hand in hand together. So, not only are we doing hearing tests, we're doing treatment for hearing loss, such as hearing aids and hearing protection to help prevent further loss. But we're also doing things like treating your mom for what sounds like benign paroxysmal positional vertigo, or
That's probably, yeah, that's some big words that she said that went in one ear and out the other for me. But
yep.
that
So
sounds
that's
right.
basically, if you've ever heard somebody talk about their crystals being loose, that's what
Yeah.
that
Oh,
is.
oh yeah. I was like the crystals in the ear. That sounded like, yeah.
It
That's
sounds
exactly what it
crazy.
was.
It sounds crazy, and I've had patients say the exact same thing as you. It's, "Oh, this is voodoo. What are you doing?" But there are methods behind our madness
Yeah.
and
They're
science
they're
behind
probably
it.
looking at you like voodoo until it works, and then it's like the
Exactly.
light bulb goes off.
Exactly. Exactly. So for me, I did a 4-year bachelor's degree at Southeastern. Left Southeastern and went to Louisiana Tech in Ruston, and I spent 3 years there. While you're in audiology school, you're very coursework heavy in your first 3 years, but you are following and shadowing audiologists in the area in different clinical sites. And then your 4th year, you do a residency year. You can go anywhere in the United States. I came back home to Tantra Parish.
Mama's
Um,
girl, daddy's girl. Yeah, that
exactly.
Abraham's
Well,
house called you home.
it it also, second degree. My boyfriend turned fiance while I was up
Yeah,
there, and then we were
yeah.
planning a wedding. So it was good to be home.
That's
Three
a lot of
three.
balls up in the air during your residency. I'm sure that was challenging.
It very much was. So came home, did my residency, and then graduated in 2017. Stayed with that first practice I was with for about 5 years. And then in 2020, I was pregnant with my daughter and I left. And in summer of 2020, I said, "Ooh, I should probably, no telling what this economy is going to do. I should probably go back to work." And that's when I got contacted by my current employers over at Slint. Dr. JJ
Okay.
Martinez is
Yeah,
our
I know
medical.
Jay. He was in the Rotary with me for a while in Ponchatoula. He married
Yep.
one of my childhood friends. Yeah, great group. So tell us about Slint, if you don't mind. Share with us, what your team is up to and who the important people are.
Absolutely. So Slint, we have a couple of different branches of Slint. In the Slint umbrella, we have ear, nose, and throat doctors. We also have a neuro-otologist. Dr. Matthew Cooper came in probably about a year and a half, 2 years ago. He is the only neuro-otologist doing cochlear implants on the North Shore. So we've got him there with us. And then we have a team of audiologists. We have a team of allergy department where they're able to give allergy shots and things like that. But we have 4 locations. So we're here in, not Ponchatoula, but we're in Hammond, right off the Club Deluxe Road. I'm there permanently, and we have Dr. Cooper, Dr. Jason Giat, and our nurse practitioner that comes to see us in Hammond. Our big main buildings over in Mandeville, slew of ENTs over there. Dr. Martinez is the audiologist that's stationed there, along with Dr. Melanie Liner. We have a Covington office that's brand new. Dr. Kayla DeGeorge is there. And then we also have an office over in Slidell with Dr. Rachel Fitzmaurice as our audiologist.
Wow. So it sounds like you have a large and dynamic team that can serve a variety of needs. And
Absolutely.
what I found, as an injury lawyer, all of my clients are dealing with doctors, and not always. Sometimes audiologists can get involved, but that's not the most frequent. But what I notice are they love having different location options. So here you have an audiologist here in Hammond area, Ponchatoula area, have another one in St. Tammany, and sometimes it surprises you. They may live here in the heart of Ponchatoula, but prefer to treat in Mandeville because it's on the way to or from work, and it's just great to have that kind of flexibility. Did you know early in your career that you wanted to be part of a bigger team, or did you kind of dream of having a little, shop with you and one secretary, or how did that come about?
I never wanted to own my own private practice.
Right.
That's just not something that spoke to me.
Hmm.
I do like the fact that I am with ear, nose, and throat doctors. So you mentioned before our connection with speech language pathologists, but our connection is not only with them, but also with ENTs and neurologists and cardiologists as well, because everything's connected. So
Right.
I like the fact that I have that ENT there with me in the office, and it's kind of I hate to use the word one-stop shop, but it really is.
Right. Yeah.
So if
Yeah.
you come into me to do a hearing test and I notice, oh, hey, like there's a growth happening in your ear, or you're completely impacted with wax, I can pop you over with my ENT. Or if you're seeing my ENT and they say, oh, we really would like for you to see audiology to see if there's fluid in your ear or how
Sure.
that's impacting your hearing, they pop you right over to me, and we're bouncing back and forth. And that saves not only our patients time, also saves co-pays and things like that. We're all in
Yeah.
one spot.
That's a great point. I didn't even think about the financial end of things. That's neat. And Lord knows with the price of eggs, everybody could love, would love to save a copay right now.
Right?
I want to share a comment that's come in with you from somebody who's a dear friend of yours and mine, Ryan Griffin. Ryan and I served on the TARC board together. Of course, your mom is kind of a legend of TARC. Today's a special day for TARC because it's Radiothon Day.
Radiothon.
I was able to go on at like 11 o'clock and had a blast with all of the TARC team. Your mother, as the founder of the very special Miss Louisiana pageant, longtime supporter of TARC on a variety of levels, from chief cheerleader and fundraiser to just person who does everything. I know that organization is really important to your group. And I'm sure you want to say hey to Ryan. Ryan, thank you for tuning in. Ryan asked how we're doing. And I'm doing great because Jenny's on the show. Jenny, how about you? How are you doing so far?
I'm doing awesome, Ryan. I'm doing awesome.
Would you mind mentioning, the influence of TARC in your family? Because I know you've kind of been there for your mom to support her through all that. And is that an organization that's really important to you, like it is to your mom?
It is. So I do attribute a lot of my, I guess you would say, compassion and patience that I have with patients in my clinic
Mhm.
to being around individuals with special needs and with disabilities. So my experience with that actually starts way before Mama even got with TARC.
Oh, really?
Yeah, so
I didn't
my
know that.
dad has siblings, Nick and
Okay.
DJ, and they have, DJ's also an attorney. They have something called TAR syndrome,
Okay.
and they don't have a radius bone in their arm. So their arms are shorter. But that was always normal to me because I
Mhm.
grew up around it. It was DJ and Monique could do anything that
Yeah.
anybody else could do. That didn't deter them. DJ's just 4 months older than me. Mom and grandma were pregnant at the same time.
Oh, wow.
Kind of crazy
Interesting.
story. But DJ, we went kindergarten through 12th grade together, and
Uh-huh.
he was able to do. He plays the trumpet, he plays the guitar. So my compassion with that, and I guess my understanding of just because
Mhm.
there's a disability doesn't mean it's a hindrance.
Right.
Again, came
Absolutely.
long before TARC. However, Mama's involvement with TARC started with Madeline Latino, who
Yeah.
I had the pleasure of babysitting. Michael was actually the one that was at the house when I flooded it.
Oh,
Little Michael.
really?
So I babysat those kids for a very long time, and Maddie
Yeah.
holds a very special place in my heart. So much so that when I was doing speech clinic at Southeastern, I was in the summer camp.
Mhm.
Maddie was in summer camp, and she was being typical Maddie and gave them a little bit of a hard time, and they would come get me, and all I would have to do was walk in the bathroom and say, Maddie, do I need to call Mike? And she, no, 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 I'm good.
Well, ironically, Maddie was my introduction to TARC too, because years ago, as a very young man, I'm bellied up to the bar at Benny's, and Mr. Benny Latino, who's Michael the father's, uncle. I
Right.
guess Maddie's great uncle. He had the TARC ambassador poster of Maddie up on the bar, and we got to chatting, and I was like, "What a great organization!" I didn't realize it that at the time, my dad, who was then sheriff, was a TARC celebrity, and he was doing Radiothon every year and all that. And anyway, it just worked out for me to one day eventually be on the board and currently be in my second year as president. But it's neat that it kind of these little connections, because you obviously knew Maddie and her family very well. I have a more distant relationship, but it was her picture and her poster that was my introduction. And we've been talking about your mom, and of course she's watching and chiming in. For those that don't know, Robin Taylor Abrams, from all she does in the community, from the school board to the Strawberry Festival, and much more. You might know she's done one of my very favorite episodes on the show. But she comments here to her daughter Jeni that she says we're very proud of all Jeni's accomplishments, and I'm sure she speaks for herself and her husband Charles, who we mentioned earlier. And I wasn't joking; he is currently the nurse of the year, but he really could be the nurse of the year every year. He's just a great man and a great caregiver and just a great person. So, Robin, thank you for tuning in. How does it make you feel, Jeni, to hear that your mom and dad are so very proud of you?
It's something that obviously it makes me feel good, but it's something that they've always been a part of. They've always been behind me. They've always supported anything that I wanted to go and do and put my mind to. And I feel very grateful for that, because there's a lot that I was able to do that I wouldn't have been able to do without them. It makes me feel really good. Actually, I had to, when I first graduated, or right when I started my residency year, I had to tell my boss at the time, don't use my last name when you introduce me to people. And she looked at me like I was crazy. She wasn't from here. And I said, you'll understand why. And it's now still an ongoing joke that if the patient walks in the office, 9 times out of 10, I probably know them. If I don't know them, I know their family. And if they're from Independence and their last name ends in a vowel, I'm probably related to them. But it's a really good feeling now when people put my maiden name with who I am, because I don't use my maiden name. But when people put who I am together, to hear experiences that they've had with my dad at the hospital, or with my mom through many different organizations. Oh, you belong to Robin? Oh, you belong to Charles? Yeah, I do.
And I bet when they get to know your personality, they're like, "Oh yeah, that tracks."
That's about right.
Well, you mentioned you're now Dr. Dunnington. You go by that name. You mentioned earlier that your husband became, you went from boyfriend to fiance when you were away at school getting your doctorate. So if you don't mind, share with us that love story. How did y'all meet, or how that develop or whatnot? Like, and what's it like, going along that journey and trying to get your career started while your love life's ramping up. You're in a residency, you're planning a wedding. It's just all these things going on at once. What was that part of your journey like?
So we'll go back to Paul's Pharmacy. When I was 19 years old, I was working in the pharmacy. The pharmacist and the pharmacy tech that I worked with were actually sisters. And I was down doing my thing. I may have even been doing homework at the time and typing away on a computer. And a guy walked into the pharmacy and he started talking to the two sisters. And I popped my 2 cents into the conversation and went right back to doing what I was doing. It was their cousin, and he texted both of them immediately afterwards and said, "Who is she and why don't I know her?" And they said, "Well, her name is Jeni, and you don't know her because she's 6 years younger than you." And the rest is kind of history with him. He and I started dating. We had been together for about 3 years when I got my acceptance letter to Louisiana Tech. And I said, oh gosh, what do I do? Do I wait another year and try to go to school at LSU in New Orleans to be closer to home? Well, he said, absolutely not. You go and do what you need to do, and we'll figure us out. So 3 years turned into 6 years, and right around that 6.5-year mark, we got married. So I came home in June to start my residency. We got married in November, and then I graduated the following May. I don't have any audio, Parker. I didn't have any audio for that, Parker.
I'm sorry. I'm just waving over here like a crazy
I was like,
man.
oh, hey.
Somehow the mute button got clicked. So, you're talking about, this evolution from, say, daughter to doctor to wife and then mother. You mentioned your beautiful daughter. How does life change when she comes on the scene? And
Oh,
because I think you mentioned, was that in 2020? So, and
2020.
that's a year after you become also professor, left that out of the mix. So is now
Yep.
more balls up in the air. You know, what's that journey been like?
So that journey has been, I probably would say, our end of my pregnancy to actually giving birth to her was one of the craziest experiences I've ever had, being that no one was allowed at the hospital besides my husband, John. And I kept asking my doctor, "You sure he's going to be able to come? Please let him be in the room." And they reassured me. But everything changed in that moment. She is the center of our world completely. She likes to think, and she's kind of right, that she runs our house. But now I was telling Danny earlier here in your office, it's a constant moving door for us. So it starts at 4:30 in the morning to get up to go to the gym, and then we get her dressed. She goes to school. We get dressed to go to work. We work, and then Monday nights are dance. Tuesday nights are tumbling, and it's a revolving door at our house.
Yeah, that sounds familiar. I think most
I'm
parents
sure
and
with
youngsters.
two of them,
Yeah, they did that. I think the only difference is when you add that second one, then you just add fights that you have to break up to the mix.
we're not even going to go there.
Well, my parents tell me it's karma because Bree and I basically scrapped every day of our life growing up. Eventually, he would be the best man at my wedding. I would be his campaign manager, but it took a good 18 to 20 years to get there. But that's neat. Ryan Griffin's back on the scene here with another comment. Ryan, thank you for sticking with us. So we're here with Dr. Jeni Dunnington, formerly Jenny Abrams. We're talking about family. We're talking about work. If you don't mind, tell us, I want to circle back to your career. You mentioned Slint, all the services you provide, and how you get to become an audiologist. But what's a day in the life like in that profession? You mentioned kind of earlier this hectic routine that family causes, but I would imagine when you get to your clinic, man, it's go, go, go. And for those of us that wouldn't know what went into that, perhaps there's some young woman or man out there considering following you into that career. What's a day in the life look like?
So day in the life is in a busy ENT clinic. We're coming in. We start with our patients with hearing loss. We start with a hearing test, and we want to make sure that we are getting all of their history. We want to know about you. We want to know what brings you here. A lot of people will know that they have hearing loss and then not come in for several years. I think the statistic is like 5 to 7 years it takes people to actually come and seek help once they acknowledge that they have hearing loss. So my first question is, why now? What's going on right now that brings you into the office for you to say, hey, it's time to do this? And typically it's because my wife or my husband or my kids say I can't hear, or I'm having trouble at work. So we start out with that case history. We do a comprehensive hearing exam where we're finding out what degree and type of hearing loss you have. Is it coming from your middle ear? Is it, and it needs to go see an ENT, or is it a permanent loss that we need to address with hearing instruments? After that, we go over our results and we decide, hey, where do we go from here? Are you ready to proceed? Are we ready to start this journey together? And that's what we pride ourselves with at Slint, is that it truly is a journey. Hearing loss should never be you have hearing loss, here's your treatment, bye, see you later. We're there to follow the whole journey. Our services come with your hearing instruments where you're able to come in and ask questions. You're able to come in and let us fix something that possibly could have broken, or send it into a manufacturer if we need to. So journey starts there. You become family with us. We want to make sure that you're comfortable coming in to see us, and that you've built that relationship with us to be comfortable to say, hey, I know I was here 2 days ago, but this still isn't right.
Yeah. Well, you mentioned keywords there, relationship, and that doctor-patient relationship is so critical. But I also loved hearing the word family. Nothing makes me happier than when I read, say, maybe a Google review or a note from a client that says that my team treats folks like family. And I called a friend. I have a friend of mine who was one of my dear childhood friend's mother, and my friend passed away. And, I called her today. She had a little procedure at the hospital recently. She said, "Oh man, Heidi, who does our front desk, and Danny, who works with her, and that." Said, "Hey, I just love them. They make me feel like family, And it's just like to hear that you're bringing that approach to your audiology practice really warms my heart because people need that. I mean, obviously they have a very complicated scientific health need going on, right? But on a human level, they need to be treated like people, and what could be better than being treated like family. I want to share something here, and I'm not the best tech guy in the world. So anytime I try this, it's always a work in progress. But I'm going to bring up, there we go. You were voted the best audiologist in the parish. So,
Was.
first, congratulations.
Thank
And
you.
second, how does that make you feel to be recognized, for such excellence in your profession?
So it was kind of when they called me, just asked me for a headshot. I was like, for what? So then when I got the proof back, I said, oh, how awesome. It makes my job already is a very rewarding and fulfilling job. But to have it come back and see that people say, I'm getting the best care, I'm getting this, it really makes me feel good. It makes me strive to want to do more for those in our community.
Yeah. Well, it makes me think. I don't know if there's a best school board member award, but your dad's the reigning champ of nurses. You're the reigning champ of doctors of your type. We got to get an award for your mom so you guys can kind of round out the triple crown, if you will.
Right?
That's really neat though. But to see this excellence in healthcare, span two generations. I know you and your dad have different professions, but at the end of the day, you're helping people with serious healthcare needs. That's really special. It's kind of neat. It reminds me of my family, to see my dad be a sheriff and my brother be a chief of police. There's this special connection that all of us are just so proud of, and so I know your family must feel something really similar to you.
Sometimes
Um,
when you're brought up around that, I mean, I remember when Dad went back to nursing school. He started out as a
mhm.
respiratory therapist and then went back to nursing school when I believe I was in the third grade. And I remember, so he would work two 16-hour shifts on the weekend as a respiratory therapist.
Wow.
And then he had me in third grade, my brother in kindergarten, and he was going to nursing school. So the time I got to spend with him was, I'll never forget, he would lay on his belly with his textbook in front of him, and I'd sit on his back, and he would read me the nursing textbooks. So I guess it's bred into me.
Yeah, so you started studying before most there, it sounds like. But I bet you're just grateful for the dad time. It doesn't matter what you're doing at that
Didn't
age.
matter what I was doing.
To have a daddy who loves you be there with you is just so special. Well, look, I promised that we would be respectful of your time, and we're nearing here the end here. But I want to ask you about people in your life because we've talked about your parents who are so important in your life, your grandmother, and others. When we bring up the topic of mentors along the way, are there other mentors that are worth mentioning here? Hate to put you on the spot, and I'm not asking you to pick a favorite, but who have been other people in your life outside those we've discussed that come to mind when I ask you who mentors are?
That's such a vast, wide question for me,
Hmm.
just because there was so many aspects of life. So I've mentioned him already, Mr. Paul Dernan over at Paul's Pharmacy.
Yeah.
He instilled that work ethic and the compassion that you see in pharmacy care and taking care of patients. So Mr. Paul played a huge role in how I take care of patients today. You've got a whole board and a slew of strawberry queens that came before me.
Yeah.
I mean, you're married to one. That
Right.
that
I bet
helped
the
me.
one that introduced me to my wife is one of them too. Miss
um,
Hatfield, Queen Hatfield.
right? Yes. So I mean, those guys, they were part of my life for so long. I
Yeah.
got to watch them and see how they held themselves with grace and poise, how to present themselves. So all of those guys truly made a huge impact in my life. And then as far as audiology goes, my advisor when I was at Southeastern, Dr. Rebecca Davis, she's actually one that called me and said, hey, would you be interested in teaching this class? She's a
That's
huge
cool.
role.
So this mentor you look up to is who made the call. It wasn't just some rando intern.
Correct.
That's really special. That
Yep.
has to be
She
one of these life moments that's going to stick with you forever.
She is, I say it all the time, she's the reason why I am an audiologist. She taught that class that I'm teaching now and made me say, hey, you know what? This is what I really want to do.
That's special. Well, thank you for sharing that. You've been so giving during this interview to share your life story, but also, you're very generous in your praise of others, and I admire that. Before we close, is there anything else that I haven't asked you about? Anything on your mind, anything on your heart, just anything at all that you'd like to share with our listeners and our viewers before we go?
I'm going to guide over back towards the profession when it comes to that.
Okay.
There is a lot of people out there that need hearing imbalance help. And with their hearing health care, they need to seek somebody. What we're finding with a lot of research is that hearing loss, if not treated properly, is leading to an early onset of Alzheimer's and dementia because you're leaving yourself in what we call auditory deprivation. So it's not that you're not remembering things, it's that you didn't really ever hear it to begin with. And
Wow.
your brain works on it. If you don't use it, you lose it kind of thing.
Mm-hmm.
So seeking help early is key to that and key to help reducing that rate. So I just would like to see more people lose that stigma of, oh, hearing aids are for old people. We wear glasses, Parker, because we can't see. We break our arms. We wear casts. Our hearing just doesn't get better. So we wear our hearing aids to help us in day-to-day situations.
Yeah, and they're not so obtrusive, and they're not these giant, ugly things anymore. So many people wear hearing aids and you don't even notice.
Super tiny and small, and one of the coolest things about them is they're Bluetooth devices now too.
That's what I was just gonna say. My mom's are glued into her phone.
Yep.
And it's the neatest thing in the world. So that's some unexpected perks there. Jeni, thank you so much. You've been so great today, folks. I hope you have enjoyed this time with Dr. Jeni Dunnington as much as I have. She's just a wonderful person, and as you can tell, a great doctor. You can reach her by, I guess the easiest thing is just Google SLENT, SLENT, Hearing Imbalance Center in Hammond. They're located, I believe, at 15706 Professional Plaza. And you can get their phone number by Googling them. But as you can see, she's just the best at what she does. And she's as great in life as a person as she is in her clinic as a doctor. So, Jeni, thank you for your time. To our viewers and listeners, thanks for sticking with us to the end. We'll be back next time on Ponchatoula Live. Y'all take care.